Discussions around treatment and psychosocial support for mental health patients and illnesses. This, of course, coming about as a result of President Uhuru Kenyatta's directive during the Madaraka Day celebrations that those public officers charged with that responsibility to come up with a policy framework to address this issue. And joining me in studio this morning are three guests. To the farthest right is Samantha Mackenzie, who is a patient of clinical depression, has been there for a while. She's going to talk to us about that. Next is Dr. Chitai Murabula, who is a psychiatrist and mental health advocate here in Nairobi. Also works with government, you said. And Cecilia Mboya is a lecturer of counseling psychology at the Africa International University. Thank you so much for making time for us this morning. Let me start with you, Samantha. Talk to us about how this came about and when you realized that you actually needed psychosocial support and treatment as a result of depression.
I think it was a very long process because you don't imagine that you have depression, and there's a lot of stigma around mental illness. And I think it's very important as we begin this discussion to distinguish between mental health and mental illness, because they often get used interchangeably, where we're really talking about I'm talking about mental illness. I had been working from the age of 19. I had gone to University of Nairobi, studied law, done the parallel program because I couldn't get into the regular program because I studied under the British system. I think during my 4th year of university, I started to feel overwhelmed, but I thought it was just normal. You know, it's your 4th year of university, you have dissertations to write, you have final exams, need to pass. And then I continued to work. And then around the age of 26, 27, 28, my mum was unwell, and I was just starting to slowly feel like my body was falling apart. It was mostly, physical symptoms and physical manifestations. And I thought it was mostly just adrenal fatigue of having to keep going and continue working and not having had a break between high school, university, and taking care of my mother. But it was really in 2014, when I'd been working for about 10 years, I started to really think something was wrong with me, because I was having migraines all the time. I would feel weakness on one side of my body or numbness. And so I decided to take some time off from work and see a doctor and get fully checked out. And so I went to a family clinic, and it's really important that people know that there are these family clinics, even within the larger hospitals, within Aga Khan or Nairobi Hospital. Instead of going to the ER is just to keep you alive. The family clinic looks at you more sort of at your well-being, and I went through a series of tests, everything from my thyroid to many forms of STDs, HIV tests, because a lot of these things have the same symptoms as depression. And that's when I was officially diagnosed with clinical depression. A year before, I thought I had been seeing a psychologist who said I had probably mild depression, and we had talked about plans in which I could have better sleep hygiene, which means going to bed and waking up at the same time, having a better diet, doing exercise, getting fresh air, getting sunlight, doing all of these things that are good for your mental well-being. And I was very resistant at the time to medication, and it wasn't even suggested. But by the point that I was completely and totally exhausted, and I had nothing left in me, no reserves, then at that point, after I had resigned from my job, I'd seen a doctor, we'd eliminated all of the other potential illnesses I could have, and I was diagnosed with clinical depression. I decided to go on medication.
Mwalimu, she speaks about having seen certain symptoms and not knowing what was happening, because there's a chance that you could, as she says, confuse it with some other illnesses. What are some of the manifestations of, and especially early warning signs of someone plunging into depression, really? Because most people do not understand how it starts and then graduates to something else.
Thank you, Edmund. And thank you for allowing yourself to be vulnerable to talk about depression. Clinical depression, or before it gets to clinical, it has manifestation from different levels. It has a physical manifestation, mental, emotional, and even social. When we talk about mental, somebody feels that they're not able to concentrate on what they are doing. They feel like maybe they find they are thinking so much or ruminating so much on a negative event or something which has happened. So it's all about the mental, and it has more of negative thoughts going on in somebody's mind.
Okay.
When it comes to physical, it's just like some of the things she has talked. That feeling like almost tired, fatigued, feel like somebody does not want to do anything. Somebody feels so tired to do even very little things, even like bathing, even brushing. If it's just some little things, somebody has to amount a lot of strength to do some of the normal activities. When we talked about maybe it's social, you find somebody does not want to be with people. They want to withdraw. They want to be alone. It's like even picking a call or calling is just also work. So we find somebody does not want a lot of interactions. And some spiritual, some people think that they're questioning about their values, especially their belief systems about some certain things. So you find there are all these kind of things. So if somebody has been doing things well, they're excited about their stuff, they're excited about their own things, but all of a sudden, slowly by slowly, they start lacking interest. Not necessarily because there are some environmental changes or some other changes which have taken place, but just feeling like, I just don't feel like I want to do things. When they do that, and even the people within the environment, they start fighting some of these symptoms, then somebody could be creeping into depression.
Yeah, but what is the difference between that and just say serious fatigue, perhaps, because there are also symptoms, signs around that could be confused.
Thank you. If this kind of feelings or thinking or it takes more than 2 weeks consecutive. It's, I mean, every day is the same feeling, every day, every day, every day. Whatever somebody is doing, even if after sleeping they still don't feel like they want to do anything. If it continues for more than 2 weeks, then that somebody could be getting into a serious issue of depression.
Yes, Daktari, this issue has been of major concern to the extent that the president had to speak about it. Talk to us as a doctor and perhaps someone who sees patients and also an advocate. What is the extent of the problem really within the country? How serious is it? Is it a large number of people perhaps suffering from these things silently? Some people don't even know. Some people have come out to speak about it, perhaps.
Yes, thank you very much for hosting this this program and choosing this topic. Issues, depression, we've been talking a bit about it, and sometimes we may also fall into this trap of thinking that depression is the only mental illness. So it's just important to first say that there are many mental illnesses.
Do break it down for us. How many more do we have?
There are about over 200 mental illnesses.
The serious ones, perhaps?
And depression is just one of them. And each illness can be very serious because each illness will have, will vary. We'll have, will be from mild maybe to extreme. Each illness. So depending on that, it can affect the individual adversely. And so depression happens to be just one of them. And the only issue with depression is that it is found to be one of the commonest. And so, unfortunately for depression, it's called a silent disease, such that you may have it and not know. In fact, 2 out of 3 of people who have depression, they have no idea that they have a treatable condition. And sometimes they just go through the discomfort not knowing what's happening. Sometimes they may attribute it to many things like fatigue, maybe it's just disturbances that have to do with work and so on. And so the person goes on. But as my colleague has said, if you have symptoms that they don't go away, then it's important that you seek help. If there are changes in how you feel and your behavior, things that you withdraw, for example, and you are irritable, you are responding with a lot of anger, it could be one of the signs of depression, or you're missing work, or like she said, You just, like Samantha told us, that for her it was just physical symptoms. So these physical symptoms of headache, of problems of even digestion, constipation, things that were not there, that you know, are suddenly now, even chest pain that is constantly there. You will go for the tests, and if they turn out negative, then it's important that you accept that, to have that assessment. An assessment does not mean that automatically you'll be diagnosed with any mental disorder. So going to a psychiatrist also becomes a struggle for many patients, because you hear psychiatrist, then you think, the psychiatrist, once you get there, there'll be a diagnosis. Now, the extent of the problem is that we have about 1.9 million Kenyans who are affected by depression, and
it's a big number.
And lifetime prevalences is basically about 1 in 10 men and 1 in 4 women will suffer from depression at some point in their lives. So what happens is that a few cases of mild depression could actually resolve on their own, or with just you know, some self-help techniques, things like exercise and sleep hygiene. Like and she mentioned some of them. Samantha mentioned some of them. However, when it becomes moderate to severe, then there's need for actual intervention. Okay. And so so it's a serious problem, because what happens if depression is not treated, yet it is, you know, maybe it's getting worse, is that this person's productivity drops.
All right,
yeah, if they are a student, they'll not be able to go to school. They'll miss the classes, it will affect their performance. If it is someone who is working, they'll miss work. Therefore,
they'll just be there, but
their productivity will fall. They may lose their job.
Exactly.
No, they're not even able to turn up.
Yes.
Like you've had instances where like waking up is such a hard thing, and people think you're sleeping in, but really it's like a battle within your body to just try and get out of your body and to get your body out of your bed, and it's an impossible feeling to describe to someone. Like, why can't you get up? You're like, I just cannot move.
Before caring for yourself becomes a problem also.
Yes, hygiene. Personal hygiene becomes very
difficult. And caring for those around you.
Yes. Define for us, so you say there's mild, moderate, and then there's severe.
Yes.
How do you distinguish between those? How do you know when you've crossed the line to another stage?
Yeah, you know, it's for the doctor, they'll use some scales. There are certain questionnaires that we use. For example, there's a Beck's Depression Index, there's Patient Health Questionnaire. Depending on how you score on those questions, and it depends on the number of symptoms. So the higher the symptoms you have, the more severe it is, and the lower the symptoms, the less severe it is. We cannot classify here, but it just depends on the number of symptoms. If they are high, then you have more severe depression. However, one sign that almost is constantly present in severe depression is suicidal thoughts and maybe attempts.
Okay. But before, because you said you might not even know that you have some of these signs, so perhaps you are just there, you know, worried before you see a psychiatrist or a counselor or a doctor for that matter. The people around you, say your family members, the people who you live with, how can they be able to tell, as opposed to you being able to see them within yourself and then telling others, the doctor or the people in that case?
Can I take this one?
Yes, please.
Yeah, I think it's very difficult because one, there's still a lot of stigma around mental illness, and it's also seen as a Western disease and an African disease, and so people tend to think of it as laziness. So they tend to not actually try and get you to see a doctor. They just try and either encourage you to do better, or they get angry at you and tell you that you need to try and do better, or they try and help in well-meaning ways.
Especially in a work environment.
You need to work harder.
Exactly.
A term was introduced to me recently called suicide by good intentions, where people tell you, if you continually tell someone, what would really help is if you showered on a regular basis, or if you exercised on a regular basis, or if you ate vegetables and ate food that's good for you on a regular basis. People try and give you good advice, but then you can't do it. So in the end, you see yourself over and over again. People keep telling me what to do to get better, and they mean well and they love me. But there's so the common denominator in this must be me, which leads people to give up and to maybe take their own lives, which I found was a very interesting phrase. Suicide by good intentions.
Okay.
But I think it's mainly that that's why it's so important to have these conversations, so that when the symptoms that we've been talking about now, people can see that in their relatives and in the people who are close to them, and then try and get them to see someone. You'll find that most people won't want to go see someone. They'll be like, I'm fine, I'll get through this, this is only a stage. But I think it's really important listing those things, knowing that if they go beyond 2 or 3 weeks, that it might be a sign of some mental illness. Yes. But it's on both sides, you know?
It is,
talking more and more about what the symptoms are helps those around recognize it.
And the common denominator should be change.
Yeah.
Okay.
Change that is noticed in somebody, either yourself or someone around you, should signal that something is happening. So, for example, withdrawal. If someone who was previously very sociable, coming to meetings and events and so on, and suddenly just withdraws from these things, even from issues of entertainment and so on, they just withdraw, then that's already one sign. And another thing is, if it's at the workplace, then there is a sudden absenteeism. A person starts to be very absent all the time. It can be another sign. Then also constantly seeking healthcare services for issues that are not easily recognized. Maybe the tests are coming negative. You're having these headaches, these muscle tensions, you are tired, all these tests are negative. It's good to explore the idea that it can be depression. So all the changes that happen, irritability, for example, someone suddenly just becoming angry, all these changes that come, and then also talking. You can listen to what the person says. For example, if someone suddenly now starts concentrating on death, then you can also notice that is something that was not there. It can be depression.
All right. Yeah. So I think then the people around you also have a responsibility to be able to pick out some of these things, and I think it's important that we talk about those signs and symptoms for people to understand, so that if at all you see this kind of a thing around a family member or a friend or something of the sort, then it helps.
And not just for depression, but also you should say for all other mental illnesses.
All right. Yeah. While still on that, before we get to the issues of treatment, Mwalimu, he said the key symptom, especially in moderate and severe depression, is the feeling of wanting to commit suicide, or you become suicidal.
Yes.
You might not necessarily do it, but you think about it. You look at the future, and you don't really see much. You see your life terminating at some point. How does that manifest in people, and to what extent can it go in terms of just, can someone get to a point where they say, you know what, it is, this is it for me?
Yes, thank you. Of course, he said we have mild, moderate, and severe. And one of the clearest indicator of severe depression is when somebody starts talking about or showing signs of wanting to commit suicide. You ask about some signs. Some of the signs is, you hear is the talk. Because we are saying that mentally, somebody sees the world in a very negative way. Whatever is causing that, which could be varied. But somebody sees the world, they look, first of all, it is 3 perspectives. They see themselves from a negative light. So they don't think they have anything to offer to anyone. They feel helpless, they feel useless, and anything useless after, useless, meaningless, everything about themselves. They also look at the environment around them is everything is bad, there are no jobs, this one is this is our, Kenya is bad, government is bad, everybody is bad, everything is just bad. There's nothing, even when the president says, we look at the depression, this is just politics. Everything is looked at from negative end.
Point of view.
Then the third one is the people around, the way people are looking at me, the way people are listening at me, the way people are evaluating me. So we look at the person, the negative thoughts in their mouth, the way they look at themselves, the way they look at people around themselves, and the way they look at the environment, and just the whole world view.
Okay.
It's more and then now they start thinking, now if I'm useless, an environment is not habitable, and the people do not love me, then what is the point of living? So when we are doing counseling, those are some of the things. When we are doing we are taking a clinical interview with the clients, maybe first or second sessions. Those are the cues we pick from their talk. You ask them, how do you look at life? And they talk. How do you look about your relationships? How do you look at the whole world? And those are some of the, so we ask, we get the questions we ask are the questions which give us hints of where the person, and when we get that, first of all, we know that things are not, for the people maybe who are not trained to take interviews and those clinical interviews, is when somebody starts talking about how the world is small for them, or they feel like, what is the use of this life? Maybe what, you know, anything negative about life and about themselves.
All right. Well, okay, then before we get into the basis of this session this morning, which is to look at treatment and psychosocial support, I referred to President Uhuru Kenyatta's statement during the Madaraka Day celebrations, and this is what he had to say about this.
I have noted with extreme sadness and profound concern the recent rise in reported cases of suicides and homicides in the country, particularly femicides. Depression has today become a common phenomenon, and it affects persons from all walks of life and ages. I urge employers and institutions of learning to invest more time and resources in monitoring and facilitating the mental well-being of their charges. And I therefore direct the Ministry of Health, in consultation with county governments, the Ministry of Education, Labor and Social Protection and Public Service, Youth and Gender Affairs, to formulate an appropriate policy response. I am encouraging all Kenyans to be their brothers and sisters keepers. Check on your family members and friends and be their safe harbor. A little caring in a world where we have become too busy for one another will go a long way.
In the spirit of full disclosure, I have to say that I've actually gone through this at some point in my life. And when you talk about some of these things, I understand what you are saying, and I relate to them to a certain level. But the president there talking about a policy framework that needs to be formulated, and I think this should excite you, Daktari, as an advocate and a doctor as well. One of the things that we expect, or at least want this policy framework to address, and this is to you, Samantha, is issues around treatment. Mental health illnesses or patients are not covered by, say, the NHIF or most the corporate covers, the health covers, you know, they are not covered because it's considered not serious enough or stuff like that. But it's very costly. Talk to us about your experience in treatment.
Well, I mean, obviously, I'm very grateful that it's been recognized as a public health concern. And I do agree with the president that this is mental illness does not discriminate on age. It affects people of all ages, all socioeconomic classes, and I'm looking forward to seeing what this policy framework is and what it comes out to be. But at the moment, one, I have been paying NHIF. I've been working since I was 20. I'm now 32, for 12 years. I cannot get my antidepressants under NHIF because it's not considered a primary health concern. I had private health insurance under AAR. They increased my health insurance from 88,000 inpatient and outpatient to 135,000 due to an internal review. Probably because I have a pre-existing condition and it's expensive for them. And I understand, they're a business, they're looking at the risk. I'm a risky person to you know, cover. But that means that I cannot afford health insurance, which means that I have to pay for it out of pocket. My medication alone costs 10,000 shillings a month. seeing a psychiatrist seeing a psychiatrist and a psychologist is at least 3,000 shillings. And you should, especially if you're having suicidal ideations and have severe depression, which I have had this year, be seeing someone on every week, if possible, or every 3 weeks. It's impossible. And your productivity level completely drops. So you're not making as much money as you could or can. You're not living up to your full potential. So you simply cannot afford it. And what happens in that case is that people take maladaptive ways of coping with their mental illnesses, whether that's drinking or smoking. Buying yourself a drink is cheaper than buying yourself antidepressants. Yeah. And unfortunately, like alcohol, for example, is a depressant. So while it might...
Temporary one, though.
A temporary one. No, but while it might numb the pain for a while, it will make the situation much worse. Yeah. So and that's what leads to feelings of hopelessness. I have been there. Where you really, yes, it's a depressant in the brain, alcohol. Okay. So, but it's a way that people see as a temporary reprieve. When you don't have that money to see a psychiatrist and a psychologist or pay for your medication, and then you go to NHIF and you're told it's not a primary health concern. You go to Mathare, which is the primary mental health mental illness facility in Kenya. They don't have one or any of your medication, so you can't get it there. So it is a national crisis. And it's great that there's going to be a policy framework, but unfortunately some people are not going to make it. And that's a hard, cold fact. Sorry, just one thing. You had a show in May, because it was Mental Health Month, and it said, and in one of the statistics that were mentioned is that 5 in 6 Kenyans with a mental illness do not receive the treatment they need. 5 in 6 Kenyans. That's a really, really terrible fact. Yeah. Okay.
Daktari, you are a psychiatrist, and some of these patients come to see you at a cost.
Yes, at a cost, yeah.
It's very expensive.
It's very expensive, true. Mental health is expensive. Health is expensive in general. Yes, but just give me a minute to react to the president's speech on Madaraka Day. I was very excited at first, you know. Then the excitement transformed into optimism. Yes. So, you know, I became hopeful that something will be done. So I shared this message on my Facebook page, you know, that the president has said this and it's historic. Not once in my life have I ever had a head of state discuss mental health in the detail in which the president did, and linked suicides and homicides in our country to depression. And it's true that 95% of suicides are caused by, have an underlying mental health problem. So they are caused by mental illness. In fact, if we treated all mental illnesses, we'll have solved the problem of suicides in Kenya. Okay. And many of the homicides. And therefore, for me, I became very optimistic. And then I became cautious because, because again, intentions are good, you know, but intentions and words are only the first step in bringing change. They're the first step. But if you remain at that first step, then you'll not realize real change. And therefore, I would want, you know, this message again to translate into real benefit, because I sit there and see patients who cannot be able to afford this health care. It is very distressing, even to the doctor.
Have you subsidized cost, perhaps, as someone who knows?
Yes, and by the way, I give some services to an organization, only one in Kenya. There's only one private organization that gives subsidized services, and so I give them my services at a subsidized cost, and it gives services to Kenyans who cannot afford, you know.
Which organization is this, and how much?
And I do not want to mention it because, one, I've not talked to them about mentioning them here.
Okay. What are the costs then?
Yes, I mean, the consultation is free, and the cost of medication is almost a quarter of the market prices of the medication. So I'll not mention, because it's only one. I've not talked to the management And the last time it was mentioned, it was
an
overwhelmed.
influx of
And that shows the need, really,
Yeah,
because
yeah.
80%, of our people cannot be able to afford health care. Now, I also want to say this. The president talks about formulating an appropriate policy response. I have no idea how this will look like, or when it will start. But I've also have to say that we already have a mental health policy in this country that creates a framework for providing mental health services using a human rights approach that is consistent with our constitution and other international standards. So we actually have a very good mental health policy in place that needs implementation. In fact, it's covering the period between 2015 and 2030. If this mental health policy that we already have can be implemented, we may not even need another one. The problem with mental health is clear, is the issue of financing of mental health. In 2001, African governments committed to put 15% of their budgets to health.
That's a
general
lot
health.
of money.
Okay?
Yeah.
Kenya was one of the signatories. It's called the Abuja Declaration. You've heard it many times. We've heard it. It's been highlighted, especially by our trade unions. Now, most countries did not increase their budget. In fact, Kenya's budget to health stuck at about 5% to 6%. Only Tanzania attained that Abuja Declaration of 15%. Now, when you come to, so that's where the problem begins, because if you allocate little money to health, then the mental health will actually get a smaller fraction. But still, whatever you allocate to health, the standard out there is that at least it should be consistent with the burden of the mental health disorder. So mental health covers about 13% of the burden of disease. So 13% is mental diseases.
All right.
But the allocation is less than 1%. It's less than 1%. So if you look at facilities like Madare that she mentioned, that when you go there you don't find some of the medication, the question is, why do you not find some of the medication?
All right.
If you come to the wards,
On that note,
the wards are crowded. Why is the bed occupancy 115%?
Okay.
And
All
the
right.
answer is, let me answer. The answer is, Madare actually receives only 30% of what is allocated, and they operate at about 80% deficit,
Okay.
budget-wise.
All right.